I'm Tracy Freame. I'm the head of care here at Littlebridge House, and I have had the privilege of being the head of care for 5 years now. It's a busy job as Littlebridge House continues to support 180 families, mostly now from Devon, as we've got the 3 sites with Bristol and Little Harbour now coming up to capacity. That means that our referrals mostly come from Devon, but we still do get a few referrals from outside of our main area. But because we have that number of families, then the staff that we have to employ to care for them has increased as well. So the care team, I have 58 staff on within the care team, but that includes people who work in the kitchens and housekeeping and the sibling team, as well as the care team who look after the children over the 24-hour period that we are in operation. So within the care team, the ones that look after the children, we have a mixed group of staff, nurses and non-nurses, teachers, social workers and other professions that make a cohesive team to work with the children and families to give them the very best support that they can have during their respite stays, and also in between their stays when we keep in contact and help and support them as much as we can. So the families, once they've been referred to use the service, and obviously that does mean that they have to acknowledge that their child has got a life-limiting or life-threatening condition, which is obviously incredibly hard for a family to have that news broken to them. But hopefully they get referred to us as soon as they've had that news, and they obviously have support at home from their community team and their GPs and the hospital teams, and then they can come to us for respite. So that's planned respite throughout the year, usually about 16 to 18 nights a year, so it's not a huge amount, but that time for that planned respite means that they can come and completely unwind. We look after their children if they would like us to, or they can do that themselves. They can do as much or as little as they like. They get fed amazing meals that are cooked in the kitchens here, and we all try not to put on too much weight by eating the cakes that are beautifully presented at meal times. They get a really good night's sleep because obviously we're offering a 24-hour service. My team are awake at night and we can care for the children so that the families can recharge their depleted batteries and then go back home after a 4 or 5 night stay and start all over again, doing that 24-hour feeds and medication and physiotherapy and the really intensive nursing care that some of the children require, and being mum and dad. And it's a full-on job that they do, and so they need that rest. Other than the planned respite, we do emergency stays for symptom control. Obviously the children are very poorly and we can have them in at short notice to help the community teams and the hospital teams get on top of some challenging situations around symptoms, pain or seizures. We also obviously, our priority for care is if a child is at end of life, and then we will pull out every stop that we can to get that family here if that's where they want to be. If they want to be at home, then we'll support the community teams in offering support and advice around symptom control if the family decide that they want to be at home. But we are here every day of the year, day and night, for those families. So if they want to ring up and have a chat, then we're here to support them in between their stays as well. And the team that I support in providing that care are just phenomenal at it. Part of offering the support that we do means that we spend a lot of our time communicating with the teams that are actually out there with the children and the families. So yeah, we spend a lot of our time talking to the professionals that are back at home base for the children, and that's GPs, community nurses, hospital doctors, and that's imperative for my team to be able to provide the very best care for the children, that we keep up to date with what's been happening for them at home. The majority of our referrals actually come from community nurses, but we get referrals from parents. The odd grandparent will refer, but mostly from the nurses, the community nurses, the hospital doctors, are where the majority of our referrals come from. We offer our support from 0 years, and actually we've had several referrals of babies that haven't been born yet, because they know that they've got a condition that means that they're going to be life limited, up to the age of 21. So that's a huge age range, and it's brings with it some distinct challenges for the teams because of the conditions that we see and the age range that we support. So the conditions, unlike an adult hospice where the majority of the patients have cancer and some neuromuscular issues, here we don't have a huge number of children with cancer. We have some, but not a huge amount. The conditions we see are more long-term, genetic issues, metabolic issues, some neuromuscular, but often there's quite a large group of the conditions we see where the children actually are born and they seem fine, and then they deteriorate over time and then become profoundly disabled, which is very, very hard and, as you can imagine, distressing for a family to see. But that is the majority of the children we see fall into those categories. And the average length of use of Littlebridge House is between 7 and 8 years. So it's very different from an adult hospice where they tend to support people in the last year of their life. We support families for a very long time. The feedback that we receive from families shows that what the service that we provide is vital to their longevity. They say that they need to come and have those planned respite breaks, otherwise they just can't carry on. Services in the community are being withdrawn. Financial situation out there makes it hard for social care to provide the respite that perhaps we used to. And so the support that we give the families, even for those 14, 16 nights a year, is absolutely imperative. They look forward to it. When they're here, they often put in a booking for the next stay so that they've got something on their calendar to look forward to. They know when that next break is coming, when they can get some sleep. Do something lovely with their other children even, because obviously if you've got a child who's terribly disabled and needs 24-hour care, actually leaving the house, even if you have carers, you can't do it. Their brothers and sisters are impacted, the parents' social life is completely impacted, and coming here means that they can get a little snippet of that back. They're always going to have their child in the back of their mind, but hopefully because of the amazing care that the team give, families can really relax, knowing that their child's going to be cared for one-to-one. We're not their parents, we don't know them as well, but we try our very best to provide that top quality, gold standard care that means that those families can just chill and relax and reboot, really. Some amazing compliments they give to us, that they couldn't survive without coming, that they love the downtime, that the care that we provide is brilliant. They love the food, they love the facilities. We've got a beautiful jacuzzi that they can go in, the Snooze Ellen, which is our sensory room, they love that. They can watch a movie. Some little things that we take for granted that they just can't do. Our feedback is phenomenal, and we're so very proud of that. But we couldn't do it without the amazing place that we have around us, which helps us. The gardens all feed into that feeling of being relaxed and allowing families to have the very best time, helps being in North Devon as well, doesn't it? Because we've got the beaches and a few other lovely bits around us, which is a bonus. We had some feedback recently from a recently bereaved family, actually, and his sisters have been coming here for, well, his sister and his cousin who lives with them gave some amazing feedback about our sibling team, because we have an amazing team that cares, supports the siblings. And they wrote that they came as cousins, which is what they were, but they left as sisters. And that was all because of the help and support that the sibling team gave them during the lifetime of their brother, who actually died on Christmas Day this year. So it was very, very poignant and amazing feedback for the team, and very so important that we hear not just what we do well, because that's always nice, but also the feedback where we can do better, because we always can. Obviously, the majority of our work, probably about 80% of our work is the planned respite, but obviously we are a hospice and children do become unwell. They need additional support for symptom control and emergency stays. But obviously around end of life, then families have the choice to come and stay here, and we will do whatever we can in our power to get them here as soon as they can to provide that. Obviously, when we're providing end of life care, we only get one chance at doing that right. So it's really important that the team have all the skills, and we have all the technology and the equipment and the medication that we require here in-house to be able to provide that care instantly they need it. And that takes a lot of planning and training for the team, so that we're spot on when that family comes in with that child, so we get it right for them, and that we have the skills to be able to provide that care when we need it. It really is to say that we wouldn't be here without the amazing volunteers that we have, putting the message out there about CHSW, and that how fortunate we are that we have the facility here to be able to offer that service to the families of Devon. And I know that the families really do appreciate what we offer, but we can only offer that because of the support that we get from the community.